Hi, I am Gurdeep Singh, a family physician right now presently practicing at the Owen Sound Family Health Team. I've had a good experience with this coordinated care planning. There were some of my patients who really needed a lot more than I could provide them for, and this was something where I could get the resources and I could get other health professionals to come in and help me to deal with those patients. It does add value for the patient, and the coordinated care plan. So the way it sort of works out is it lets the patient also have a say in what he wants. He's just not like listening to instructions. He sort of sets his own goals, and with this plan we sort of try to help him to attain his goals. And some are unrealistic and some are realistic, and that's again when we all there, so we make it known to the patient that this is not realistic and this is realistic, and we can go from there and try to help him up to reach the goals. For this CCP process, like there are basically those few steps. Like initially it's the referral, then it's the interview, the care conference, and the follow-up. As far as I'm concerned as a physician, I think the first step, the referral, it doesn't take much time. It's just a regular CCAC form that just needs to be ticked off. The box needs to be ticked off. That doesn't take much time. The time that, for me, the most time that takes place is in the care conference, where we are all together, and that does take it's a one-time investment, and I think it's worth it for the patient. Sometimes some of these care conferences can take up to 1.5 hours to 2 hours, and of course as physicians we're not compensated for that well enough, but I think I owe it to my patients to do that. So since it's a coordinated care process, it sort of integrates a whole lot of health professionals together, and getting all of them together in the same room to talk about it, it just sort of increases my perception of what's out there and what can be done and what cannot be done for the patient. Like there are a lot of things that can be done, and then there are some things that I feel that should be done, but I know that we don't have those resources yet and they can't be done. It sort of gives me that idea about the things, and yes, it's basically more of a collaborative approach, and that's what's good about it. So as the whole process, it's sort of a referral, and then the interview, the care coordinator goes to the patient's home, talks to the patient and the family, and gets to understand what are their requirements. And then we have the care conference. So while we're having the care conference, the care coordinator told me they found stale fruit in the patient's fridge. And that meant, oh, now this makes sense. Now I know why his medicines were not working. Maybe he's not taking it properly. If he's not eating well, if he's not eating his meals, then he might not be taking his medications altogether. I think most of the patients would require this, but I would just say the elderly, the vulnerable patients, they are the more, and the complex patients, they're more ideal for this program, because for a complex patient, me as a physician, I cannot fulfill all his needs. So if we have a team working together and going forward would be very helpful.